die of doubt. Don't stay silent and don't stay home. If you have an emergency, call 911. When seconds count, the hospital is the safest place to be. Home is meant to be our safe place, but heart attacks and strokes don't stay home. Don't avoid the ER out of anxiety. Don't die of doubt. Don't stay silent and don't stay home. If you have an emergency, call 911. When seconds count, the hospital is the safest place to be.
Coming up for the American Heart Association, it's the latest episode of Connect with the CEO. Today's topic, the science behind the COVID headlines, how AHA-funded researchers are finding answers. I'm Greg Donaldson, the Heart Association's Senior VP of Corporate Communications. And during the next hour, we'll hear from the experts and we'll host a live discussion featuring your questions and answers. Along the way, you'll learn how the American Heart Association's funded researchers are working with speed and agility to address issues related to the current COVID crisis. We'll learn more about the implications of their work, and they will share how they're working to answer questions about the impact of COVID-19 and how innovative therapies, tools, and strategies will lead to breakthroughs in discovery. As a reminder, we encourage you to join our conversation and submit your questions during the live program. You can always email them to askAHA@heart.org. We'll answer as many as we can in the time that we've got. Your questions and answers will come shortly, but first, let's introduce your host for today's program. It's my pleasure to introduce you to the American Heart Association's Chief Executive Officer, Nancy Brown, who will lead today's discussion and provide us a glimpse of the American Heart Association's relentless and continuing impact, even as our society navigates the ravages of the global pandemic. Since 2008, Nancy has elevated the Heart Association to become the preeminent global leader in heart disease and stroke science innovation. Under her leadership, and as part of a career spanning 3 decades, the association continues to pursue its mission of serving as a relentless force for a world of longer, healthier lives. Today's American Heart Association leverages the power of more than 40 million volunteers, scientists, staff, and donors. Hello again, Nancy. Happy Thursday to you.
Hi, Greg. Happy Thursday to you as well. And thanks to all of you for joining us today, especially the members of our Cor Vitae Society and our Paul Dedley White Society. We are so grateful for your support of our mission and so excited about today's program. Just to level set the discussion today, this past week, we passed a very grim milestone in the world. Nearly 1 million people have died from the COVID-19 pandemic globally. And here in the United States, we are nearing 7 million infections and 200,000 deaths. Our hearts, of course, go out to the families and the friends of those who have lost loved ones, to all of the healthcare workers who have put their lives on the line to care for people. And we recognize and understand what a tragedy this really is. And at the American Heart Association, as we've talked on these broadcasts before, we are very, very focused on COVID-19 as the virus is having an enormous impact on the populations we serve. For example, the implications for the heart and the brain are wide-ranging and in some cases fatal. Some of the early research models suggest that nearly 23% of hospitalized individuals who have COVID-19 experience serious cardiovascular complications. About 8 to 12% of them in these models have acute cardiac injury. And we see these stories that are so tragic of young people who are having strokes with no pre-existing conditions. Many are experiencing fatal arrhythmias, blood clotting issues, and blood pressure abnormalities, which can lead to heart attacks and stroke. And sadly, so many of those who do recover suffer from lingering effects of the virus known as long haulers syndrome, where patients struggle with severe symptoms such as trouble breathing, fatigue, aches and pains, and elevated heart rate months after clearing the viral infection. So as we know, COVID-19 is what is referred to as a novel coronavirus, meaning it's a strain never before seen in humans. And as a result, it places healthcare providers at a disadvantage because there's so much that we don't know about the way the virus impacts the body. How does it spread? How can it be contained? And how can it be treated? Getting answers to these and many other questions has really inspired the attention of researchers across the globe. It has inspired our attention. As you know, the American Heart Association provides leading science to guide physicians so that patient care is evidence-based and equitable. We have an urgent need for the science to catch up to this ever-escalating rate of infection and climbing death toll. And so I'm very proud that the AHA recognized early on the role that we could play with our resources and our network of scientists globally to make a real difference in helping to fight COVID-19. And we rapidly responded. Outside of our existing research grant cycle, we quickly invested $2.5 million in rapid research grants to fast-track scientific research and health tech solutions. The demand was historic, and just a couple of weeks after announcing the award and giving just a very short 20-day window, we had over 750 applications for individual scientists who had ideas of how their work make a difference in the cardiovascular effects of the coronavirus. And so we selected 15 leaders, as well as the 4 centers of health technology who have been working diligently. And today, we're going to hear some of the progress. I also want to mention that we have a coordinating center that's collecting results from across the research projects, and this is helping us make sure that we're leveraging the information that we're learning from the research that we're funding. So today, I'm so privileged to be joined by three outstanding American Heart Association funded researchers who are doing incredible work with speed and agility to address related to COVID-19 and to find innovative therapies, tools, and strategies that can lead to breakthroughs. And I'd like to start by introducing Dr. Jane Friedman. Jane is the Director of Cardiovascular Research at the University of Massachusetts Medical School, and she also is the newly appointed Editor-in-Chief of our journal, Circulation Research, which is one of the flagships the American Heart Association communicates with the scientific audiences. And Jane, let me just ask you a quick question as you come on the screen here. Your research, of course, was one of the initial studies that we selected for a rapid grant back in April, and you're focused on understanding the role that platelets play in addressing the cardiovascular implications of COVID. Could you tell our listeners exactly the problem you're trying to solve by understanding the role of platelets?
Sure. Thank you, Nancy. Yes. So platelets are the cells that circulate in our blood that help people stop bleeding when you're injured or you cut yourself. But when things go awry, they are also the primary cells that are responsible for heart attacks and sometimes stroke by obstructing the heart vessels or the vessels of the brain. It turns out when people have COVID, they often have clots in both large and small blood vessels. But interestingly, platelets also act as immune cells. So our study is to determine how these platelets can both fight infection as first-line fighters of COVID, but also not at the expense of causing clots in the heart or the lungs. And we've already had some very interesting results from patients who've come to the cardiac catheterization lab who are having heart attacks or other places with strokes. And it's fascinating. We've already been able to see COVID within the platelets and COVID activating the platelets in many different ways.
Wow, that's incredible. And I look forward to digging in and learning a bit more about the application of your research to patients and patient care. But before we get to that, in addition to Jane, I'm so honored to also be joined by Dr. Sanjam Sethi. Sanjam is an interventional cardiologist and assistant professor of medicine at Columbia University Medical Center in New York City. Sanjam, thank you for being with us today.
Absolutely, thank you for having me.
Yes, we're so honored to have you and to learn about your research. Your also was selected among that huge group of 750 applicants for a rapid action research grant. And you're focused on the issue we read about in the paper and hear on the news all the time, the issue of clot and clotting complications from the virus. And I know you're working on developing a risk score to be used in clinical decisions. Tell us about your science and what it is you're doing with the AHA resources.
Absolutely. So as Dr. Friedman mentioned, there is a propensity for patients with COVID-19 to develop blood clots. Now, all of us, I function as the director of our pulmonary embolism response team, and pulmonary embolisms are blood clots that are in the lungs, or in the lung arteries, I should say. And it was really out of that work that it led me to develop this project, because when in New York City, at least, the surge was very rapid. I mean, we went from almost no cases to 100% of the hospital plus within a matter of a couple of weeks. And at that point, we were getting many phone calls about patients having blood clotting disorders at presumably increased risk because of COVID-19. And so what we thought would be a very helpful clinical decision-making tool would be if we had a mechanism by which we could predict which patients would be more likely to develop blood clots and therefore be able to target our treatment algorithms better for those particular patients. Now, blood clots are treated first by giving a patient a blood thinner, what we call anticoagulation. However, anytime you're going to give that kind of a treatment, there's going to be a risk of bleeding. So how do we determine the right patient to get the more aggressive therapy? That's what we've been sort of working on for the last several months, is figuring out the right patients to get that therapy up front, even before we prove that they may have a blood clot, to potentially prevent it and improve outcomes.
Well, that'll be fun to dig into in just a few moments as well, because I know when there's a promise of a treatment, everyone wants to have it. And I think the point you've raised about who are the right patients to receive anticoagulation therapy is so important. And we're so proud also of the work you're doing. Let me also introduce now our third guest, Dr. Mukesh Jain. Mukesh is Professor of Medicine and Chief Academic Officer at the University Hospitals and the Vice Dean for University Hospitals at Case Western Reserve University. That is a mouthful. Welcome, Mukesh.
Thanks, Nancy. It's a pleasure to be here.
Thank you. Now, Mukesh, your journey to studying the COVID treatments was a little bit different from Jain and Sanjam's. You are a well-funded scientist through the American Heart Association Allen Frontiers Group Initiative in Brain Health and Cognitive Impairment. Just so that our listeners remember, we have funded 3 scientific teams with $40 million of resources to help us understand the issues around cognitive impairment. And Mukesh's team are of course one of the lucky groups that are working on this, and they're making really great progress. But as you were thinking about your work in cognitive impairment and brain health, you realized that research that we're funding could potentially benefit COVID patients. So tell us a little about that, Mukesh.
Yeah, sure. So, the work that we were doing in dementia as part of the grant that Nancy mentioned in dementia was really focused on blood vessels. And so just as a way of background, you're going to hear a lot, the audience will hear a lot about blood vessels today. Maybe just to set the stage, I'll note for you that blood vessels, you can think of them as tubes that really constitute the body's highway to deliver oxygen and nutrients, fuel, to all your cells. And if these highways become congested, you've heard Dr. Friedman and Sethi use the word clot. So a clot occludes blood flow in these highways. Nutrients don't get to cells and the tissue can suffer. So in dementia, we think that there's a slow, over many, many years, a challenge for these blood vessels to be able to supply oxygen and nutrients that leads to damage to the brain and dementia. Now, in early April, when we started to hear reports come out about strokes, heart injury or heart attacks, purple toes, I'm sure we all remember that. I suspect for the 3 of us on the call today, Dr. Friedman, Sethi, and I, it was probably pretty quickly that we started to wonder if a unifying possibility or a common denominator would be problems of blood vessels. So blood vessels, if there's a problem acutely, it can result in stroke, heart attack, or compromise of blood flow to your extremities and lead to the purple toes that you've heard about. And
Mukesh, can you tell us what you mean by acutely, just so that our listeners know? And we're on the edge of our chairs listening to what you say. And maybe if you could move a little closer to your computer, we could hear you just a tad better. Thank you.
So acutely means all of a sudden. So as opposed to in the case of dementia, which occurs over obviously many, many years, here that congestion of blood flow in the blood vessel occurs like that. And when it occurs like that, the body has no time to react and you get an injury. If it's an injury in the brain, it's a stroke. If it's an injury in the heart, it is obviously a heart attack. And so we think the biology, and I know we're going to get into this a little bit more, the biology that we've been studying in the context of dementia might be very important and operative in the case of the acute setting like COVID.
That's very fascinating, and we are going to dive into all of these thoughts and findings in a little bit more detail. But before we do that, I want to make sure, back up at 30,000 feet, Jain and Sanjam, tell us what got you down the path of being interested in COVID research. It sounds like Mukesh made a great case that As a scientist, you're already thinking about these issues of the human body, and then along comes this novel coronavirus that's an insult on the body. But give us a little sense of the moment you decided, boy, I need to do something here. Jane, could we start with you?
Sure. As I mentioned, we had been studying platelets and not only their role in causing clots or preventing bleeding, but also their role in fighting infection. And we had specifically been studying their role in fighting flu infection. So it's been known for just a couple years that when people have pneumonia or they have an acute flu infection, they often wind up with a heart attack. So why do people for about a week after they have the flu have an increased risk of heart attack? We had been studying the platelet and had shown quite clearly that the platelet was probably the cell that was responsible for this. So we had already been studying flu infection in our laboratory as well as flu patients. And when we started to hear, similar to Mukesh, that people were having clots during the acute infection, because we also know there are some similarities between the flu and COVID viruses, we thought perhaps that's what's going on, that there's some similar processes going on. And we became very interested in looking specifically at the COVID virus. And what we found is there are some very similar processes, but there are some things that make it quite distinct as well.
And Jane, let me just ask you a follow-on question before we go to Sanjam. So we're hearing about this twindemic that could be coming in the fall, and one of the things we're doing at the American Heart Association, very actively promoting the importance of flu vaccination, through our broad network. Will your work be studying this twindemic and the possibility? What if someone, the relationship between flu and coronavirus?
Well, right now, and that's a wonderful question, and getting your flu vaccine is so important. Right now, we're able to show that the processes are quite different, suggesting that it could be additive. Later on, when we are looking in the laboratory in animal models that we can infect, we'll be studying what happens when both of these infections occur at the same time. So yes, we will be studying it, but we haven't studied it quite yet.
Okay, thanks, Jane. So Sanjam, tell us what got you interested in COVID research. And did you have the same kind of of course, this is so obvious, I need to be doing this, or did something else inspire you?
So like I was mentioning earlier, it really got born out of necessity in our clinical work. I mean, I think to give some people a perspective, in New York City in April, every single doctor was a COVID doctor. I mean, I was in the ICU and my team was psychiatry residents and orthopedic surgeons, and I was in a surgical intensive care unit as a cardiologist. I mean, really the entire enterprise of our institution and every institution in New York City was really focused on COVID. And as the director of the pulmonary embolism response team, I was getting 3 times as many calls, and we actually are going to publish this data, that we normally get in terms of clotting disorders occurring compared to the similar period in the previous year. There's a study out of France as well, which shows that for similar patients in the ICU in different time periods, the rate of clotting was so much higher. So really, and while there is some relationship in flu and H1N1, certainly nothing to the level that we were seeing at that moment. So that was really what tipped us that we really need to investigate this further. And maybe if we can alter the patient's propensity to clot or treat it up front, we may be able to alter their long-term course.
Yeah. And we're so proud, of course, that Columbia has been one of the flagship inaugural members of our COVID-19 registry powered by Get With The Guidelines. And, through that registry, we, within over 150 U.S. hospitals, we're tracking consecutive days of patient information, including, their risk and health coming in, but also the treatments, did they have clotting, what kind of medications. And so all of this information will be available to our scientific network as well from across the country. And thank you to Columbia for leading the way in being one of our flagships. Okay, so now the moment everyone's been waiting for. What have you learned, and what do you think the work that you're doing how will it help us put this puzzle together about COVID-19? And Jane, may I start with you by asking you?
Sure. We've already, as I mentioned, learned some incredibly interesting things. I'm not sure if you can see this, but this is a very high-powered picture of a platelet. And this spot right in here clearly shows a COVID molecule that's been taken up by the platelet. And we've been able to find this in our patients who are having heart attacks and coming through our cardiac catheterization lab. When we've studied patients who are later in the process, the platelets don't have that. And we've been able to look at the differences between the time points, showing that as with many processes in COVID, there's an acute event that happens and there's a later event. And this really suggests to us that things need to be treated differently. And by looking at this and digging more, we're really starting to look at when it would be appropriate to use medications that might inhibit these processes. Things that inhibit platelets include simple things like aspirin. And so would that be a problem early on when someone's having an acute infection? You may not want to stop the platelet from taking care of that COVID molecule that's in it. To be able to do these things quickly, we've really had to reach out and partner with a lot of new collaborators and companies that have really helped us facilitate this. It's wonderful that so many people are on board and have sort of the same mindset to get the work done. And it's really allowed us to move very, very quickly.
Thank you. That's exciting. And I think, again, the power of research, understanding these issues so that what we find can move into actually how patients are treated at various stages of the infection. Mukesh, tell us what you have learned so far and how you think that will impact patient care.
Sure. So we have been studying a couple of different aspects of the blood vessel that we think can impact COVID. So we've been studying the cells that make up the blood vessel. It's called endothelium. And then there are cells that are in the bloodstream. You heard from Dr. Friedman about platelets. There's two other major cell types called red blood cells and white blood cells. The red blood cells carry oxygen. The white blood cells provide protection for the body. So why is that important? What is important to appreciate is that all these cells and the blood vessel cells all work together to make sure that you have adequate blood flow, and they have to work properly and in concert. And we've identified in our team critical molecules that are really important in the proper function of the blood vessel cells and those red blood cells and white blood cells. And by virtue of that, we can control some key processes like oxygen delivery and nutrient delivery. And so what we've done, Nancy, in I think really rapid fashion over the past few months is leverage that to really accelerate our efforts for therapeutics. So we have 3 therapeutics, 2 that are farther along, that are all, I think, exciting with respect to COVID. One is a therapeutic that enhances the ability to deliver oxygen. The second is a therapeutic that reduces inflammation and immune cell hyperactivation that occurs. And then finally, a third new therapeutic that increases energy production in cells. And so again, we were developing this for something else, the dementia work, where we think it's relevant, but we've now accelerated the therapeutic aspects of our efforts to try to meet the demands of COVID.
And when we say therapeutic, of course, we mean a drug therapy. So are you looking at repurposing existing drugs, Mukesh, or is there, tell us a little bit more about that.
So both actually. So 2 of the therapeutics are brand new and would be first in class. And the third that regulates immune function is a repurposed drug. So the first 2, they have funny names called ENO and P7C3. Won't mean much, but they're the ones that increase oxygen delivery and energy production. The repurposed one is actually a drug called bortezomib. which at very, very low doses can really dampen the immune system, and we think can have very ameliorative effects in COVID. Probably the most relevant for this discussion from what you've heard is that in preclinical studies, if you give bortezomib, again, at really, really low doses, you can prevent clots both in the arteries and in the veins, so in the blood vessels. And that is a big deal, as I hope the audience appreciates from the comments from Drs. Friedman and Sethi so far.
Thank you, Mukesh. And I just want to make sure to put an exclamation point on the fact that the research that the AHA, along with our partners, the Allen Frontiers Group, is funding around cognitive impairment / dementia, has you on this path of looking at new therapeutics for dementia, cognitive impairment. That's the work that we have funded with significant donor resources. So thank you to our donors. And it's incredible that that we might be able to have two wonderful accomplishments with that money, one for the pandemic and one for dementia. And it's very, very exciting. And of course, there's a long way between studying the potential of these therapeutics and all of us rolling into our doctor's office to have these things applied if we need them. But boy, this is, so very promising and very, very exciting. So thank you for sharing that. Sanjam, tell us about you. Tell us about your thought about what made you decide. You've already talked a lot about how you were seeing all the clotting, the frontline healthcare workers. I remember those days when everyone was involved in patient care on the front line. But what was the aha moment that you wanted to study COVID more scientifically?
I mean, it's a combination of all of seeing this on a repeated basis, and we're learning quite a bit. So our research is more focused on the clinical aspect and really patient risk stratification. So there was a lot of enthusiasm very early on for giving blood thinners to these patients, but then we saw outcomes where they were having bleeding issues and things like that. And so understanding first who are the best patients to target, can we figure out who is more at risk for blood clotting, and then target our therapeutics appropriately? That's what we've really been focused on. So one of the things that we've discovered, which will hopefully be published soon, is that there was a lot of enthusiasm very early on for a molecule called D-dimer to be the way to which you could understand. And what we're going to show is that it's really a blunt instrument and not a good enough tool to accurately discriminate the kind of patient that you want to target. And then certainly when it comes to therapeutics, we've been working very closely and we did develop a randomized control trial to study these things in a more controlled fashion, to be able to understand really, when you eliminate as much bias as possible, which therapy and what degree of therapy is important for these patients.
There's a word that comes to my mind when I listen to all of you, and it leads into the next question. I think, the global humanity and people throughout the world are desperately seeking to understand and, very concerned about what they should be doing as individuals to be as healthy as possible. So if they are exposed to the virus, they don't have a horrible outcome. And, all of us who follow the news, one finding gets people to say, okay, we all need to take this, or we all need to do that. And this is the power of publishing, findings in scientific journals that are peer reviewed. And I can't resist asking this question to our scientific journal editor, Dr. Jane Friedman, editor of one of our 12 journals. Could you just speak to our listeners a little bit about the importance of publishing these studies in journals, and how that helps, these studies become, move into their next level of development?
Yeah, so it's been, it's a very interesting position editing one of these journals, and it's been even more interesting during this era of COVID. A lot of things become publicly available before they've been peer reviewed and have already shown that if you work too fast to make things publicly available, sometimes there can be problems. And because there's so many important findings that everybody needs to know, broadly in the community, not just scientists, people really need to get the information fast. And what we did when we got, very early on, we received a clinical study from China looking at certain kinds of blood pressure medications before this had been published. What we did to make sure we felt comfortable publishing is we did very, very quick peer review. So you have to be flexible in a time like now when you don't want to just put the data out without peer review, but you want really good peer review. We found very, very good people who could look at it within a day or 2 days, statisticians who could look at it within a day. And we were able to publish the paper within a couple of days, and it had been fully peer reviewed. But you have to understand the urgency of many of these findings that came, especially at the beginning, when people really needed to know this for their own health. Should I take this medication? Is it okay for me to go outside? Is it okay for me to interact with other people? We knew so little, and it was very important. And I felt a lot of pressure, but honor as an editor for this journal to be able to participate in this.
And, I think the public trust is so important, and the power of peer review. And, I can comment on this as CEO of the American Heart Association. Peer review is the gold standard. It's the gold standard of how we select research that we'll fund, like research that these three incredible science leaders are doing on behalf of the public and on behalf of the AHA. Peer review is how we decide what gets published in our journals and what doesn't get published in our journals. And peer review is how we decide what will be presented at our scientific meetings, like scientific sessions or the International Stroke Conference. And so it is the gold standard, and very exciting to see how the community has really rallied to move more quickly and to move more collaboratively. And that really leads into my next question. I'd love to hear each of you comment on what is different about doing research during a pandemic. What are some of the challenges you face, but what are some of the exciting aspects? And Sanjam, let me start with you.
It's a very good question, because it's like being on a roller coaster and actively moving and adjusting by the moment. So part of our grant, we developed a randomized control trial that was pragmatic and was really born out of the pandemic state when 90% of the patients were COVID positive, and we got a lot of buy-in throughout the hospital, and we had the IRB rapidly approve it. And then all of a sudden the number of patients, in a good way, dramatically decreased. Right. And so now we have to shift our gears on how this study was not applicable with the lesser degree of patients that are coming in terms of the study design and things like that. So being really able to rapidly shift and still be able to answer the questions in a thoughtful, scientific way has provided challenges, because as you know, and as I think everybody on the call knows, is that predictions, we've often all been wrong, right? And I think understanding through science is the only way we're going to get these answers, because things are so unpredictable in the way that it's behaved throughout this year.
And I want to drill in just a bit on that. Maybe you could describe what a pragmatic clinical trial is for our listeners. And then secondly, the scientific method, talk a little about that. You start with a hypothesis and you're on a journey, to understand. Maybe you could comment on both of those, listeners.
Sure. So why don't we take the hypothesis question first? So our question was, how much blood thinner do we need to give a COVID patient? So there's a standard that every ICU patient gets, and it appeared that was not enough based on what we were seeing. And so do we need to give them a full dose treatment is for somebody who has a diagnosis of clot. And in these patients, because of how critically ill they are, you may not always be able to achieve a diagnosis because the CAT scanner may not be available, what have you. So that's the question. So the question was, what dose do we need to give? So we engaged all of local and as well as outside of our institution experts as to determining what were the best drug choices or treatment intensity choices to study. And then the scientific method of there, and I'm sure Dr. Friedman and Dr. Jain can speak to this as well, is that there is a degree of scientific purity depending on their study design. So if you want to study something that is just naturally occurring, there's going to be potentially biases or other factors that may not be a part of it. For instance, there's an association between coffee and cancer, and that is not in real associations because coffee drinkers are more likely to smoke. That's sort of the classic textbook example that often people use. And so that kind of thing, if you're studying something that you're not controlling for, then you have these other biases come in. And so when you do something called a randomized control trial, you're giving a pre-specified criteria of the patient entering into the trial and randomizing them without bias. So they're completely randomly assigned to one group versus the other. And that can only be done when the thought is that the two treatments are equal and there's a question between the two treatments. And when I say pragmatic, is the way that we had designed our trials, we had actually, rather randomizing individual patients because we had such a large flux of patients, we were randomizing them by actual unit, by physical unit. And patients in one unit would get one treatment versus another treatment. And that's something that is really done in a surge type of a situation, not in a non-surge type of situation. So that kind of thing. And now we have to redesign that so it's more applicable to what's happening now.
Thank you. That's so helpful. Mukesh, what have you seen in terms of this environment of working on, being a leading scientist during a pandemic? What have been the good things you've seen? What have been the challenges?
Yeah. So I think the challenges, and then I'll shift to the good things. The challenges, I think, have been the type of work that my laboratory does is much more what we call bench research. For the audience, that's like your chemistry lab in high school or college, that kind of stuff. And what we had to do, and most universities across the nation had to do, was because of social distancing and all the other issues and having adequate PPEs, et cetera, we had to start to limit the number of people that could work in the research labs. So that's one. So a lot of people, if you didn't need to be there, you worked remotely as much as possible. Number two, we shifted everybody's focus within the university to COVID. And I'll come back to that comment in a second. So those were some of the adaptations. So yes, the work that people were normally doing sort of took a back seat, if you will. But then again, it's a pandemic and we haven't faced anything like this in a century. So it probably was prudent to shift everyone's attention to this major health burden. Now, that actually has been also a silver lining. Having everybody shift towards it has, I think in a way that I've never seen, given us common purpose and a sense of community within the scientific enterprise. So, often the greatest discoveries or inventions come at the intersection of disciplines. And if you think about COVID, it affects so many parts of the body. Some we're learning about and some in many ways that we still don't understand. So you need to have people who are understand how viruses work, virologists as they're called. You need to know, you have to have teams where people who are immunologists that understand the immune system, which becomes activated in an aberrant fashion in COVID. And then you have to have people that have expertise in the heart or the brain or different organs that can be affected. And what I've seen in our community, and I have enough of a sense of this nationally as well, you've seen within academic institutions, individuals come together around this problem from diverse disciplines and work in a way and develop collaborative interactions that they might not have ever done, all in an effort to attack a common purpose, which is COVID. The final comment I would say is that's occurring, Nancy, within institutions. but you can expand that to a national scale. And that is really, and I think we've all seen this evolve in front of our eyes as you watch the news. You've seen discoveries made in the public sector, support from the federal government, from American Heart and organizations like that. And then you've seen those discoveries start to move into the private sector, where biotech and pharma can help advance those discoveries, the vaccine being a classic example right now that is being tested across the globe. So I think the silver lining has been within institutions and broadly across the nation, the coordination of diverse individuals with a common purpose.
Really incredible. And it's been heartwarming to see, as someone who has worked in this field for over 3 decades. It's really wonderful to see the level of global collaboration that you described, Mukesh. Jane, what would you add to that? And specifically, do you have any examples around data sharing or sharing with researchers that have similar kinds of projects to yours?
Yeah, so you know, a lot of the changes we've seen, Mukesh has mentioned, but by us, many people having to be home, it's also spurred a lot of pop-up type meetings and ability for people to share information. We have shared our information already with other groups who do similar types of research to compare, and some things we found have been similar and some things we found have been quite different. And, you know, it's really wonderful because we've all been able, as Mukesh said, we weren't able to be in the lab for a few months. We've all been able to return in varying degrees. And that's really been, we've been able to merge to be more complementary. And I do have to mention that my own laboratory was very fortunate during the months later March, April, and into May, when I'm in a very large research building here, when nobody was here. My own laboratory was actually, the people working on this specific AHA project were allowed to be here. We were given special dispensation because of the grant. So because that grant happened so quickly, we were actually out of the lab for only a very brief period. So I really credit the American Heart Association for being able to facilitate this kind of work through this specific program.
Thank you for mentioning that, Jane. And we've seen that with a number of our COVID rapid action research grantees. You know, the work is so critical that exceptions were made for people to be doing that work. And Greg, I'm going to turn to you because I know we have been flooded with questions from our listeners. So let's hear what's on the mind of our viewers today.
Sure, Nancy, and thanks again to Drs. Friedman, Jane, and Sethi for their valuable insights so far. You're right, there's extraordinary amount of interest, and we're blessed to have this opportunity to have this conversation. We do have a few questions coming in, and one is a rolled up question, and Dr. Sethi did a very nice job of admonishing us about speculation. But in the context of early learnings, do our guests have any signals? Are they seeing any signals? And you may want to ask this, Nancy, signals of long-term implications for the from the coronavirus?
Yes, so please jump in, you all, to that question. Any long-term implications of the coronavirus? Do we know that yet?
I think that there's still, we need to understand that a little bit better. So the concern from my interest or what we normally see is there going to be residual clot in the lung or in the lung arteries long term? And I don't think we have that answer yet, because normally when we think about long term, we're thinking about more than 6 months out, and we're really kind of just at the 6 month mark now. So I think that question is still going to be one that's answered, at least that one particular question.
And you know, I might add on, this is an important moment for me to say this, just as we've invested as the American Heart Association, thanks to our donors, in the COVID-19 in-hospital registry, we're now considering the possibility of creating an extended, what is called a longitudinal, meaning long-term patient follow-up registry of individuals who have been hospitalized, what happens to them long-term. And this is really important to our mission, of course, because of these thought that there might be longer term neurological effects, longer term, damage to heart muscle. And we are committed to understand that. And we're working now to develop resources to be able to launch such a registry. Greg, what else do we have?
Well, Nancy, I think the other question, one that's come in from a clinical listener, Dr. Friedman mentioned that the virus can be found in platelets. I'm wondering whether she thinks that platelets provide the mechanism for the virus to spread throughout the body and cause injury far from the lungs, like the brain or the kidneys.
That's a terrific question. And it is a question we're asking as well, particularly since we see them inside the platelet. It is known in another viral infection. It is known in HIV that it can be taken up by the platelet and spread. So the assumption is, although this isn't as chronic of a condition, it may be able to be spread through the platelet. If it is in the platelet, I can tell you, because we've done incubation experiments with platelets in COVID already, the platelet will destroy the COVID within about 20 to 30 minutes. So the spread would have to happen within a shorter time frame. But we haven't yet had a chance to look at this. We would do this sort of study in an animal model where we would take platelets that have the COVID and start looking at other areas to see if the virus had spread. But that's a great question and one we hope to answer.
Lots of questions again, Nancy, that you might want to ask our guests about relative to antibodies, reinfection, vaccines. Do any of our guests have any perspectives that they can share from where they see this pandemic that might be helpful to our listeners?
Please jump in if you do.
I guess I can take a stab at it, and others can chime in. But with respect to the reinfection, I think, was one of the concerns, and we're starting to see, there's been a couple of cases of that. I think that the numbers are pretty low, and it's at least the current thinking is that might be from individuals who had sort of a weak response initially to COVID, so their immune system wasn't quite revved up enough, and that rendered them susceptible to a second infection. But I think, all of this stuff we're still early in the game in sort of really understanding the virus and its sequelae. So I want to make sure the audience takes this with a grain of salt, if you will. But the numbers are low, which is great so far on reinfection. But if it does occur, it's probably because of an initial response that was not super robust.
Okay. Anyone have any thoughts on vaccination development, antivirals, any things that you're hearing, things that we're all hearing about on the news? Any scientific input that any of you'd like to make on those?
Well, with the patients we're caring for here at my hospital, they've been, we've been seeing some benefit from the plasma from infected people, the therapy from that. And, there's been some mixed studies about that, but I think there'll be more information. A lot of the things that are being developed, nothing is a cure, but things are helpful. Also, how to take care of the patients in the hospital. We know so much more than they knew even during the first waves that happened in China and Italy, leading to better care for our patients here. So some of it just has to do with how to take care of their lungs, how to position them, things like that, and how to put the caregivers at less risk. So I think we've come a long way in those particular areas.
Great, thank you. Dr. Sethi, did you want to add, or Mukesh?
I was just going to add, Nancy, that as we all know, there's just been a tremendous global effort in vaccinations. Just for the audience, vaccinations, you get up front to prevent it. Antivirals is different. That's once you have the illness, you want to block the virus from perpetuating its effects. And then there are anti-immune therapies that we've referenced already in this discussion to dampen the exaggerated immune response that has been seen in COVID. My own feeling is that all three major forms of therapies are going to be important ultimately in the treatment of patients, depending on when each individual is identified along that continuum. I think people should be optimistic and cautious at the same time. Optimistic that we will have vaccines and we will have antivirals. Cautious in that given the novel coronavirus, going back to what you said, Nancy, it's novel because it's new. We haven't dealt with it before. It's going to take some time, and we need to let the studies, we need to let the science, we need to let the randomized trials that Dr. Sethi mentioned earlier, let them go through their proper course, not try to rush it. And we will eventually get a vaccine that works and protects us. We will get antivirals that help us if we have been infected so that it can reduce the ill effects of the virus. So we're going to get there. We need to be patient as a community. And for the audience, recognize that we've touched upon this before, but there is obviously a worldwide effort in science to combat this. So we will be successful in the end. It's just a matter of time.
Yeah. Letting the science process have its due course, even in an accelerated fashion. And again, in all of my years of funding, billions of dollars of scientific research at the American Heart Association, I have never seen the scientific community globally, locked together, from researchers to clinicians to journal editors to funding organizations, all on this mission together. But you can't cut corners. At the end of the day, it will be so much faster than it normally is, and maybe not fast enough for for all of us who are used to things being instantaneous these days. But I think the scientific method really matters. And for all of our friends of the American Heart Association on this call, this is the foundation of the American Heart Association, is our science. And that is why we are so proud, to be able to have resources funding three incredible leaders like the three of you. Greg, do we have another question?
Well, I think sort of to summarize the other theme before perhaps you turn to your guests for their final thoughts, one sort of summary theme that you might want to ask them about. As you say, there are hundreds and hundreds of people viewing and watching this right now, and these are patrons and donors, people that care deeply about scientific discovery. And the question they ask is, what can people like them do to enable and further empower incredible scientists like the three of you to make discovery happen in a time like this?
Great. Jane, can we start with you to answer?
Sure. Well, first, I would say take care of yourself. The most important thing is everyone just needs to patience, as we've heard about for discovery, but patience for all of us. All of us are living through the same things as all of you, with our families and the fear and the fatigue. But please, wear your mask, be careful when you go out, socially distance, don't put yourself at risk in any way. That's the first and foremost, most important thing. And, and secondarily, heart disease is still a huge thing. It hasn't gone away. So all the usual things you've heard from Nancy about taking care of yourself, taking care of your medical care, everything like that. All those things are really numbers 1 and 2 together. And stay involved and stay involved in the American Heart Association specifically. Learn how different ways you can help, and that's really I think the most important things right now to supporting science, all of us, and all of you.
Wonderful, Jane. Thank you. And Mukesh, maybe I'll go to you both to ask you this question. How can our viewers help? And any final thoughts that you have that you'd like to leave our viewers with today?
Well, I think Jane said it beautifully. Stay safe, take care of yourself and your family, stay healthy, stay engaged. And I think organizations, supporting the efforts of organizations like the American Heart is one of the best ways that you can stay involved. And we're going to need your support. We're grateful for it. We're going to continue to need it because we've understood a lot, but we have a long way to go. And that's sort of my take home message. Stay involved and help us together. We will get through this.
Thank you, Mukesh. Sanjam, what would your final comments be?
Yeah, I mean, I'd like to echo a lot of what has already been said. It's been said very well. I think it is paramount to do all of the things that you can do to reduce your risk. Health is of paramount importance. But what I'd like to say is that there's many local initiatives. So you can be involved on the local level, on the global level. The American Heart Association is an absolutely great resource. I do want to mention to everybody out there that the hospitals have done their best to be as safe as possible, so don't neglect your other heart conditions. I know we're focused on COVID for this talk, but there was certainly a dip in the patients presenting with heart attacks. So please, get care if you need it. The hospitals have done a very good job of preventing patient and staff transmissions through all of their initiatives. So whichever thing resonates with you, whichever way to be involved, choose that. And there's really a myriad of ways. And we are, like Mukesh said, cautiously optimistic that as we learn more and more, we'll be able to stem the tide a little bit.
Yeah. So Dr. Sethi, Friedman, and Jane, wow, incredible work. We are so proud to be funding the three of you and other select scientists working on the novel coronavirus and its impact on our bodies and our communities. You make us really proud. And I know that our donors and volunteers who are listening today are so proud that they have helped your work be enabled. And, Greg, I might just add to your question, what can people do to help? The American Heart Association inspires the science of leaders like Drs. Jane Friedman and Sethi and many, many others. And there are, we can do more with resources. And so please help us as you think about the revenue generating and philanthropic efforts of the American Heart Association. That's what allows us to provide funding to these three incredible leaders and others like them. And so thank you again to all of the members of our Core Vitae Society, our Paul Dudley White Legacy Society, and all of our volunteers who listen today. We are so grateful to you for your ongoing support. We appreciate your time today, and we look forward to bringing you up to date on other topics next month. And so with that, Greg, I will turn it back to you to close us out.
And thank you, Nancy, as always, for your vision and your leadership. Our special thanks, too, as Nancy has said, to Dr. Jane Friedman, Dr. Mukesh Jain, and Dr. Sanjam Sethi. Save the date for our next conversation with Nancy. It will be Thursday, October 18th. That's 1 p.m. Eastern Time, 12 Central, and that would be 10 a.m. on the West Coast. That's all the time we have for today's program. We thank you again for joining us on today's special event. Watch for a complete replay on demand of today's live event. It'll be coming to your inbox shortly. We will see you next time.